Going to the beach for me or going to a water park, it's almost overwhelming sometimes because I'm looking and I'll tell my husband, I'll say, gosh, look at that spot on the back of that person's leg. Like, that looks like it's concerning. Wonder if they know that's there. It's this type of melanoma that will present as a pink spot or a white spot. It's very concerning. Honestly, there is such a demand in dermatology. And, I think that there is a lot of misconception too around the field, and that a lot of people, I think, default to thinking that dermatology is all cosmetic. It's something that will be for everyone.
Welcome back to another Spectruss Speakeasy Podcast. Today we've got Emily Brewer with us of the DERM Center here in Chattanooga, Tennessee. Welcome to the show.
Thank you for having me.
Absolutely. Now, the DERM Center, of course, you have that, but you also have the DERM Expert Podcast that's about to be released here, right, in the next couple of months?
Yes. So excited to get that started.
Awesome. So I'm excited to hear about that, and also want to learn about the DERM Center and your journey into dermatology. And 17 years now, right?
17.
And what made you want to get into dermatology?
So, it's funny because dermatology was really not a specialty that I really planned to go into as I was going through school. We were required to complete hours in dermatology to graduate, and that was actually my first experience in the derm field. And when I went for that rotation, I walked away from it and was like, this is it. This is for me all the way. I can't see myself doing anything else. And it's funny because as I went through other rotations, other specialties, I would be, listening to a patient breathe or their heartbeat, and the whole time I'm looking at their skin. And I'm thinking, I'm doing dermatology on these patients, and this is just absolutely the right direction.
Oh, wow.
Yeah.
So I've got to say, I was thinking actually this morning, I was getting ready for the day, I was thinking about our podcast, and what we're going to talk about.
Yeah.
And one thing that crossed my mind was like a little bit of anxiety was similar to, I have a buddy of mine who's a psychologist, and he's a PhD psychology, and he actually teaches at UTC. And every time we have breakfast just to chit chat, and it's just a common conversation, I always get so nervous that he's going to be like analyzing me because he's a psychologist.
Yeah.
So sitting down here is like, she's going to be analyzing my skin. So I made sure to put on my moisturizer, and I was like, I hope I did my skincare routine enough. I hope I don't get too nervous and my cheeks get red. But
I love it.
when people walk around, like, do you see like all the different skin issues?
Oh my gosh, I do. So going to the beach for me or going to a water park, it's almost overwhelming sometimes because I'm looking and I'll tell my husband, I'll say, gosh, look at that spot on the back of that person's leg. Like, that looks like it's concerning. Wonder if they know that's there. And then, it finally got to a point where I was like, I've got to stop this. This is just too much.
Did you ever go up to him like, hey, you might want to get that checked out?
So I don't typically. Now, if I was at the grocery store and I saw something in front of me that I was really, or like a melanoma or something that I was really concerned about, I might at that point, but not ordinarily. I don't typically go to people in the grocery store and say, have you had your rash checked?
Right. I'm sure the beach has to be like a sensitive area because, like, I know every time I'm at the beach, especially if it's like, the redder areas of Florida, like, you're going to see some good old people out there with no sunscreen and like smoked red.
It's tough. That is tough, honestly, to go to the beach and literally see tanning oil still happening.
Yeah.
Blows my mind.
I've got to admit, I've done that before.
Oh, no.
Yeah, I'm one of those people. I'll probably be sad. I've already come see you for my skin as it is. And, that's actually how we met, was through, because I've dealt with red cheeks, and wintertime always gets really hard for me. And I've seen a lot of dermatologists in the past, and it started around 30 years old. And I started noticing in the wintertime I get these red splotches on my face, and it was kind of isolated to my cheeks. Now, I've tended to always kind of flush easily, like drinking a whiskey or a wine, some sort of alcohol, or if I have too much caffeine, if it gets warm. But the splotches were different, and so I went to, I think, a dermatologist at first, and I forgot who it was, but they walked in the door. I think I've told you this story, probably the first time that we ever met at your clinic, but they were like, it's rosacea, and basically just tossed me some sample prescriptions and then walked out the door. I mean, it was literally maybe a 45-second visit and then walked out. And so I tried these heavy rosacea medications for a long time, but it kind of wreaked havoc on my skin more.
Yeah.
And it was like drying it out more, but it would still get red and splotchy. And I went to allergy clinic, and they're like, you're allergic to dogs. Well, I have the furriest dogs.
Oh, no.
They're Australian Shepherds, and it definitely doesn't help. But it wasn't until literally just a couple of years ago I finally went and I saw you at the DERM Center, and we kind of went through all the different tests, and it definitely seemed peculiar, but it's like really dry skin. And now since I've stayed on top of not letting my skin get too dry, so I feel like either a baby or old people use like the humidifiers at night.
Let me tell you, though, I actually recommend it
Yeah.
all the time to patients. But, I mean, it really is good for your skin. But to your point, that's such an unfortunate story because I hear that from patients all the time that have, skin diseases that in the dermatology world are very common for us to see and treat. So it is very easy, I think, to get into that habit of saying, oh, here's what you've got, here's a treatment, see you in 6 months. And for us, it's common, and it seems like it's that straightforward and that simple. But for the patient, it's not. It's the first time they maybe have heard that, or it's the first time that they have actually understood what is happening with their skin. And truth be told, at the DERM Center, that's a really huge part of what we focus on, is taking the time to spend with the patient, educate on what's going on, and educate on the treatment plan so that they come away from it feeling empowered by the knowledge of what's happening, and then they can treat it and have better outcomes.
Yeah, yeah. And that, in my experience, that was definitely the case. And I liked how, because I came back multiple times and we were testing different things, and you didn't just write me off immediately, which is nice because I'd seen a lot of dermatologists and allergists and different people.
Yeah.
And it was, I'm about to turn 40. So it's almost a decade of me dealing with red, rosy cheeks. And still to this day, I carry some, and I hate to admit this, but some like cover up in my bag. Because if I had to do a commercial or some sort of video at work, it's embarrassing to have, blotchy face. And
I totally get it. I have rosacea too, so I completely get it.
yeah.
And, it is embarrassing. When you get anxious or hot or, like, to your point, alcohol, anything that, can be a trigger, it's stressful when you feel that flushing happening with your face.
Yeah, yeah. But since staying on top of like really hydrated skin, that hyaluronic acid, and then a good moisturizer, humidifier, feeling like an old person or baby, whichever one I'm not sure yet. But this has been the best winter yet. Like it's very rarely flared up. Maybe if I'm a few whiskey drinks in at home, you'll see a little bit. But it's really not been bad, and that's been really nice. Like, what you all do really directly affects confidence levels. I think because so much of the skin, it's on our face. You can't really cover it up.
There's actually a really huge psychological component that we deal with in dermatology a lot. When you're talking about rosacea, or you're talking about acne, skin disorders where patients, they pick, they pull their hair out, they pull out their eyelashes, their eyebrows. I mean, there is a huge psychiatric element that we deal with in dermatology too.
Yeah.
So.
Wow. I mean, especially the face. I mean, I'm sure all parts of the body, especially the ones that become painful and that sort of thing. But you really can't cover up your face in our society, and you need to walk around, and most people can't even wear hats in a lot of places.
That's right.
And it's kind of hard to cover this stuff up.
Yeah.
So really, I could see how, it helps my own confidence, knowing like, all right, my skin's clearer and better. Like when it's having a breakout, like I do not like going out, like staying inside.
I get it.
So you went to school, board certified dermatology, and then came out, worked in dermatology, and then started your own practice. And how long have you had your own practice now?
So we opened our doors in January of 2023. So we are starting our third year now, headed into our third year. And we have grown exponentially in such a very short time. I was by myself when I opened the practice, and at the start of year 2, we hired another nurse practitioner, and now here we're at the start of year 3, and we just hired a new PA. So we're growing, and a big part of our mission is making sure that we're available for our patients, that we are available for appointments, that we're available when patients have a problem and they need to be seen. So accessibility is a huge part of what we are at the DERM Center.
Yeah, that's awesome.
Yeah.
And so these new people you're hiring, I mean, they come from background dermatology, and how was it finding them? And
so the nurse practitioner that works at our office, she does have a background in dermatology. She has a little better than 10 years of experience in working in derm. Our PA that we just hired, she's new into the field of dermatology. Truth be told, and I don't think she would mind me saying this, she's actually been a patient of mine for quite some time.
Okay.
And she just has a tremendous love for the field. So she's very motivated to learn, and she is going to be incredible.
Oh, that's great.
Yes.
And you've got a whole admin staff as well. So how many total work there?
So we have 8, and we actually are in the process. We just hired a new medical assistant as well. Okay. So the growth has been tremendous for us.
probably about to outgrow that space, right?
We're close. In fact, we're probably to our max. So kind of thinking through what that growth plan looks like is kind of where we're at right now too.
Gotcha.
Yeah.
Now, what is like the majority? Do you have like what's your average patient look like? I mean, is there an average, or is it all over the map?
It is a wide range, truthfully. We treat from birth to 90s, 100s. I had a patient just the other day. He was 101.
Oh, wow.
So, I mean, we treat a full range. Eczema, we do skin checks. We treat skin cancer, psoriasis. The list goes on. We treat a tremendous number of skin and nail and hair diseases.
Okay. Mm-hmm. And so I know we were talking before this about like, your, I guess what's the right word for it? Your the way you like to treat, like the least amount of pharmaceutical drugs possible.
Mm-hmm.
And I mean, what's kind of your principles there how do you operate normally?
Yeah, I definitely, when I treat a patient, I like to treat very aggressively right out of the gate because I like for patients to see results. Patients want to see results, so I like to get patients better as fast as we possibly can. It, builds their confidence in themselves, but it builds their confidence in us as providers. But then once we get to a point to where they have stabilized, then I like to start seeing, okay, if they're on a systemic treatment, I like to start decreasing that dose steadily to find, okay, where you were doing great at 100 milligrams of a medication, let's see how you do at 50. Let's see how you do at 25. And then find that dose that they can stay on where they are able to continue to see positive results, but yet we're titrating down. I like to do that because for me personally, I like to take as few things as I possibly can. I like to try to keep a healthy, clean diet and be mindful of the supplements I take, the medications that I have to take. And I really like to have that same mindset with my patients too.
Yeah.
And I think by and large, patients appreciate that. Very few people come in and say, I want the heaviest dose of everything you can give me.
Yeah.
Absolutely.
I mean, in my personal story, I was telling a little bit, that was the first thing someone came in and did was through, at another practice, just through pharmaceutical drugs. That means like, all right, well, good luck, basically. And like, I didn't know what rosacea savannah to go home and look it all up. It was kind of a bizarre interaction.
Oh, and that is the last thing that I want for my patients. I do not want my patients leaving that visit and having to go look things up and research.
Because if they get on WebMD, like they've got cancer and they're dying.
Right? It is ending with that every time.
Yeah.
But no, with patients, the education is a huge element. Educating the patients on what they have, on how it needs to be treated, what are the triggers? Rosacea specifically, there are very specific triggers that will cause a flare-up. And for a patient, it's important to understand that. So the education is a huge element. So if we don't discuss it verbally in a room, we're sending patients home with education that they can have, that we have provided, that they can look through and understand things better.
Now, you said 17 years practicing. Have you seen a change in like what patients deal with over 17 years, or?
I absolutely have,
Really?
even specifically with melanoma. So that one in particular is a good one, I think, for us to talk about because obviously melanoma is deadly. And it's interesting because going through school, melanoma, we were taught to look for the black suspicious mole. Yeah. And while, many times that is still the case, there is a type of melanoma that we do see with patients that, quite honestly, as a provider, I think all of us would say we lose sleep over. It's this type of melanoma that will present as a pink spot or a white spot. It's very concerning because it's not something that our eyes, as trained dermatology eyes, is not something that we would necessarily see just right off the bat the way we would a black mole. So I'm very diligent in explaining to my patients when you're doing your skin checks at home, anything that looks different. So if you have all brown moles and then all of a sudden now this pink one has appeared, or if you have a red spot that's just not healing up, those are the things that you really need to be monitoring for as well, not just the black mole that everybody in their mind defaults to when they think melanoma. So amelanotic melanoma is what this type of melanoma is referred to. This is not something, for me personally, that was a huge part of what we learned about in school. I would say over the past probably 10, maybe 15 years, it has become more prevalent. And there's more information for us, at least, to go off of what we need to be monitoring for on our patients, but then educating our patients for them to monitor for on themselves.
Wow, that's wild. So
Right.
Has that really just come up in the last 17 years, you think? Or they just didn't think to teach?
Yeah,
about
I
that,
think
or-
it's just become more knowledge around it.
Okay.
It's probably always been there, but I think now there's a better understanding of, okay, these are things that are problems that we need to be monitoring for. But there are also other things that we've seen more prevalent over the past few years. Hidradenitis is one specifically. It's a very painful, what we now know to be autoimmune disease that patients face, where they have these very painful boils that come up in areas that are skin folds, so under the arms and in the groin, under breast for women. And it's very painful, and it can be very, it can scar horribly.
Oh, wow.
And I think, over the past several years, there's been more awareness brought about this type of disease that patients face, because I think a lot of people were very embarrassed of it and they wouldn't talk about it. And they didn't want to have to come into the office and show anyone.
Right.
And now we see new biologics coming on the market that treat it. And I think that there's more awareness around it, thankfully.
Yeah. I mean, with autoimmune disease, usually that means it's not really treatable, right? You just try to keep them from flare up from happening, or
manageable, I think, is the key word. Okay. So autoimmune diseases, treatable would not be the word that I would use. Manageable would be the word I would default to. But yes, manageable.
That's wild.
I know.
It seems like our bodies almost get confused with, I don't know if the things we're putting into it or the things we're around, or you think it was this way 100 years ago or 200 years ago? Like, I think things have changed.
I think things have changed. I think that things have changed, but I think honestly, too, our knowledge has changed. I think we're learning more. I think more questions are being asked. I think more information is available. The research, on several different topics is available now for people to go after and form their own opinions and conclusions. And I think that there is more conversation around some of these things now.
Yeah. So, it's kind of perfect segue into the DERM Expert Podcast.
Yeah.
That getting started off the ground now, launching June 1st, right? This
June
year.
the 1st, yes.
So what, sounds like that's the reason you're launching this, right? Like, just for the lack of information. Maybe any other DERM podcast out there that you've really seen that?
There are not any that will be the format that we are going to be launching. So the DERM Expert Podcast is going to be a way for us to provide education, because, like I was telling you, education is such a huge part of what we are at the DERM Center, and it's a huge part of what I try to implement with my patients. So being able to reach a population of people and provide this information so that we can bring awareness to certain skin diseases and certain problems that people may be facing that they don't, understand that there's a treatment for, or that they don't know that there's a treatment for. That's the type of information that we want to be bringing to light with the podcast.
It seems like there's a need for it, right? Like, there's a lot.
There is. There really is. There is such a demand in dermatology, and I think that there is a lot of misconception, too, around the field, and that a lot of people, I think, default to thinking that dermatology is all cosmetic, that it's all about, injectables or lasers or, chemical peeling. And while that is a part of dermatology, there is a medical side of dermatology, too, that everyone can be a patient for dermatology. Everyone can have a skin exam. Everyone can have the education about safe sun exposure, sunscreen, what's safe, and how do you apply it, how frequently. So I think that it's something that will be for everyone.
So where do you see, what's the layout going to be, or the format of the podcast? How's it going to differ?
So there will be episodes where we have other field experts that come on, where we can talk about how their field overlaps with dermatology. So rheumatology, for example, there are instances where I'll see a patient with psoriasis, but the patient also has psoriatic arthritis, which is not in the field of dermatology. So there are patients where there are overlaps with different specialties. So I would love to have, other experts in their field come on and contribute to those topics. And then also would love to have patients be able to share their stories and talk about how they've been impacted by different dermatology diseases and diagnoses.
Yeah. The other doctors I've been to in my life, first one that comes on mind would be like all the crashes I've had racing, so broken bones.
Trauma.
Trauma. I always feel like when I go to those doctors, it's more like absolute, like, yes, we know the answer. Like, we set it and we put it in some sort of cast. And
Very definitive.
Yeah.
Yep.
Even with the head injuries, like, you get a CAT scan, we make sure there's no brain bleed. But with skin, I feel like there's so much that's unknown that people are trying to figure out all the time. And compared to like all these other fields, like in just my own personal experience, there's not as much. I mean, there's a lot of research, obviously, but there's just a lot of unknown. At least my own little experience, I feel like there needs to be more information on this. This could solve a big need, I guess.
I agree, because I think, honestly, a lot of dermatology patients, too, they go to the internet. They go online and they say, okay, and I've got this type of bump or this type of rash, so this must be what it is, and I'm going to go to the pharmacy and buy a cream and treat it. And it's basically putting the responsibility of diagnosing and treating on the patient with that mentality. So by being able to provide information on things that maybe they can take away and have an understanding of, okay, this is something I really need to seek professional help over, or this is something that maybe I can start with this option at the pharmacy and see if I get results. And if I don't, then I need to speak with someone who can really customize a treatment plan for me.
Yeah. And you're really treating, in dermatology, it's the whole body, right? Not just the face. It's
full body, largest organ. Your skin is the largest organ. So yes, we treat from top to bottom of the feet.
Yeah. Is there an area that stands out that you're treating most at the DERM Center versus others, or?
I would say we treat a lot of acne. We treat a lot of psoriasis and eczema. We do a lot of preventative skin exams. We do see skin cancers. We treat a wide variety, to be honest with you. We also do some cosmetic treatments, but we keep that very limited because the real focus of the DERM Center is very medical focused. We want it to stay very medical focused.
Yeah, yeah. Well, even, like Botox and fillers, those sort of things, that can still help, like you mentioned, like with the confidence part,
Absolutely.
So many people think that's superficial, but I think now it's become so common, like people want to look younger and the best they can for longer,
Absolutely. And there are things, too, that are available now outside of injectables that you can do that, are not surgical. It's very effective. Chemical peeling, microneedling, doing things to get your skin to regenerate and do things that it already knows how to do naturally. I love that concept. So we do offer microneedling. It's a very effective way to boost collagen growth and get your skin to do what it already knows how to do.
Yeah. I definitely need to do that. I haven't done that. I've tried Botox before, and it's wearing off. I tried probably 6 months ago, and I guess that's my third time. Mainly crow's feet. Like
I love it.
I hate whenever I smile and I get those crow's feet on the side.
I had mine done a week ago, so
really?
It's still settling.
But microneedling I need to try just because, I'm turned 40 next month, as I mentioned, and I look in the mirror and I'm like, holy shit, I'm starting to see like the gray hairs and all the lines and
I had a gray eyelash the other day. I was like, working in the field of dermatology, didn't even know that happened.
Right.
So that was a terrible surprise. What is that?
Yeah, right. Just not fair.
It's literally not.
I think the longer people can stay looking younger, it's helping boost confidence and helps me feel better about it. I don't want to, everyone's like, smile for the camera. And I give kind of a smize, because I don't want to see the crow's feet and those things.
I totally get that.
And one other thing that's very interesting about derm is like you said, you're treating from 0 years old to 101 a couple of weeks ago.
Yeah.
Like, everyone really deals with dermatology. And,
My grandmother, she came in not too long ago. She's 96. She'll be 97 tomorrow, actually. And, still treating her. And, there is dermatology for everyone, regardless of age.
Yeah. So we've got spring coming up, which for me, I'm happy about because my skin starts settling down.
Right.
For whatever reason, I think vitamin D seems to play a effect in some of my skin as well. Probably just overall body.
Cold weather, dryness is a problem.
Yeah. And so now warm weather's coming out. I'm excited about it. My skin usually gets a little better. Tan probably covers it up too, which I know you probably don't like that.
I'll pretend I didn't hear the tan part. Although you can still tan with sunscreen on, just gonna put that out there.
Okay. How does that work? What sunscreen do you use, or
Now, a mineral-based sunscreen, you're not really going to see tanning from that. But now a chemical-based sunscreen, which tend to be lighter weight products. Okay. Most people like to use more of a chemical base on their face, at least I do, because it's lighter weight. I can make up on top of it. But with a sunscreen, so a chemical-based sunscreen, you are still going to see some tanning that can happen with your skin. You're really just preventing cellular damage.
Okay.
So you can still wear your sunscreen and still get a tan.
Okay. All right. Now, what's your skincare routine? Is that something you can share?
Sure.
Okay.
Honestly, I have a very simple skincare routine because I have a busy life and I don't have time for a 12-step routine. And honestly, it's not necessary. So, In the mornings, I wash my face with just a gentle cleanser. I love hyaluronic acid, so I'm a big fan of the HA intensifier, so I use that every day without fail. Vitamin C, I don't use it consistently, but for the most part, I do. And then I moisturize and sunscreen every morning.
Okay.
And then at night, it's very, very consistent. Wash my face, same cleanser. Retinol is a must for me, and I recommend it for just about every patient. And then moisturize, and that's it. So it's super simple.
Okay.
Retinols are great because they help to keep your skin clear. They help with cellular turnover, helps to keep your skin looking young. But then also, too, if you see little actinic changes or precancerous changes happening on the surface of your skin from sun, if you're exfoliating that routinely and you're turning those skin cells over faster, you can really help to fight that precancerous change, too. So I love retinol because it has a cosmetic element to it, but there's also a medical element behind it that I also love.
Gotcha. Yeah. Now, is it the same brand across all those products or different brands? You kind of picking and choosing?
Yeah, I'm pretty consistent with SkinCeuticals. I love their products because they have very good data behind them. I use them personally. They work well for my skin. I've seen them work really well with other patients too. So I'm pretty dedicated to that brand, but I will say from time to time I do try other brands too.
Okay.
And like we were talking earlier, I have a daughter who's about to be 13, and she has just about every brand that a pharmacy would carry in her bathroom. So, so I get to see the effects on her skin.
Yeah.
Sometimes the good and the bad.
Gotcha. Yeah. So is there a dermatology tip you'd like to give for springtime? I know that's pretty hard to have a generic one, but is there one that stands out out of curiosity?
Two things, actually. So in the spring, I like to tell patients, do spring cleaning for your skincare. Go through all of your skincare products. Anything that is expired, get rid of it. Check your sunscreen expiration dates because sunscreens also expire. Toss them if they're expired and replace them. So I like the spring cleaning skincare concept. And then sunscreen. I reiterate with spring break coming up, summertime coming up, really you should wear sunscreen all year long, but during those times, it's a good time to really start a new routine with wearing it consistently. 30 SPF minimum. Every 2 hours that you're outside, you should reapply it.
Okay.
Yeah.
I'm bad about that last one, especially.
Oh, no.
Don't tell anybody. Don't tell my dermatologist.
I won't write it in your chart.
Good. I mean, that's a lot of information. I think we've covered a lot today. I don't know. How do you feel about it?
Yeah, great.
Yeah.
I'm excited about the podcast. I'm excited to get it going and to get some information out for listeners.
Do you have your first guest already picked out?
I do, actually.
Did you want to give that away or a little?
I do. So our first episode, we're going to talk about probably one of the most common topics in dermatology. We're going to talk about acne because it can affect teenagers, it can affect adults. And, it's definitely something that at the pharmacy, there are so many products that are for acne to pick from. And we're going to talk all about those products and those topics. And I'll be having Autumn Newman. She's one of the nurse practitioners at the DERM Center. She'll be coming on as our guest.
Awesome.
Yeah.
Awesome. I look forward to hearing that.
Yep. I'm excited.
Awesome. Well, I think that was a good intro for today and get people kind of hyped for the upcoming podcast.
Yes.
Anything else you want to add to it that I may have missed?
I don't think so. Wear your sunscreen. Check your moles.
Well, thanks for joining us today, Spectruss Speakeasy Podcast with Emily Brewer. Be sure to check out the DermCenterTN.com for any of your dermatology needs, and also be on a lookout for the Derm Expert Podcast. Our first episode will be launching June 1st and have all of your dermatology needs and answers to all your complicated questions. Stay tuned, and thanks again for joining us.